Alright guys, welcome to the stream. Welcome to the next episode of Project Hospital, where we are going to continue using our hospitalization function, which we just set up last time, just recently. And let's see, we set it up for a while. Oh gosh, you cannot be serious. Are you telling me I didn't save last time? Could be. That could be a trouble. However, I think we're fine. Worst case scenario is that we are, again, have to redo a couple of diagnoses and whatever. I'm basically concentrating on the woman in our hospital, and I hope that she's already there. I mean, we stopped. I think she was staying there for quite a while, so okay, hold on. Alright, first of all, yeah, she's already in there. Oh, good. Actually, okay, so yeah, we lost some time again, so I really have to, like, I need somebody in the chat, basically, to tell me every time, just before finishing the stream, that, hey, don't forget to save. It's kind of weird because I really think I did save. But if you check it here, load game, it's only autosave. So, yeah, I think I lost. I don't know how much, but it could be quite a bit because 10:36, I think I streamed probably another 5 minutes, so that should be fine, I think. Anyway, let's just back to the game. And I believe, let's just open this one up. Now, we always do something, which I always want to do to make sure that I'm not screwing up something. Let's see all our people. Actually, it's 2 o'clock already in the afternoon. Look at that. We actually don't have a ton of people here in ER. Only 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 13 people. That's really not a lot. Do we have anybody waiting for player? Yes, Kate Walker. That's not Kate Walker. Who is Kate Walker? Okay. How does she look? She's not there. Okay, so Kate Walker and Paul Brown. Okay, so Paul Brown is... Okay, let me get rid of almost everybody here. Oh, he's in neurology. Paul Brown is in neurology. So, we have one Kate Walker, who I already put it here to make sure that we are not forgetting it. Alright. I'm gonna get rid of everybody and... Let's see... We don't have anybody here. With 3 people here, that's okay. Oh! Jordan Harris is also waiting for us. Holy crap, people are waiting for us. So let's take a look at Jordan Harris in a minute. So that's the problem with stopping the game sometimes, you know? Nobody waiting for us here. Nobody waiting for us here. Oh, Paul Brown, yeah, we know you. And nobody's here. Okay, so we're good. Alright, so what we're gonna do is first, before getting to Paul Brown, which is our prime suspect, first of all, I want to go to... I want to see all the time what's going on with you here. Okay, so I'm gonna try to keep focus on this because I want to see how... And by the way, you have to be obvious in the list. Lisa Taylor, okay? Actually, she's already simple because we already know... Well, we already know that that's what she has. However, we don't know if she has any of these serious symptoms. So it's probably going to change the way how I'm going to treat hospitalization in the future. but I'm just trying it out on her and ease ourselves into, using the hospitalization properly, basically. So let's start with Kate Walker. Okay, you have, and I'm gonna try to arrange these things that it's not, covering her. You have conjunctivis, allergic or bacterial. Yeah, I think we've done it before. And we haven't done anything, but both of these are neurology issues. Now, neurology right now, we have 4 people. That's kind of interesting. We have 4 people in neurology, while we only have 13 in 13, roughly the same. Okay, you know what? I'm gonna send you to neurology anyway. Okay? Yeah. Okay, and then what we're gonna do is we're gonna do a neurological testing. How about that? That should actually clear up which part you have. If not, then we're gonna take it from there. Okay, so Kate Walker, you're taken care of. Jordan Harris, we already know that he has diabetes. Now, from my experience, when you have diabetes, you have to make sure. Okay, we actually did that already. Look at that. Echo is already set up for that. Okay, because, so I don't know why he's waiting for the player. You do an echo, yeah. Because we might need some ACE inhibitors, okay? Now, other things are not, I'm not so crazy about. Uh, Interview, physical, with diet modification, he gets that anyway. Interview, blood test, no need. Blood test, no need. So this is the only thing that we have to, but we must because it can be life-threatening. Okay, no need for physical, for example. I don't know why, actually. Sometimes I think we need that because he could have like edema or whatever, and I have had a huge, oh, bloody as well, a huge mosquito. Okay, so you're set, and Lisa Taylor is laying down on the bed, and then we're gonna go to this guy, and let's see what he has. He has TIA, which is neurology. Okay, both of them are, which I don't know what is actually. Transient ischemic attack is similar to a stroke, usually lasts up to 24 hours. No permanent damage. Okay. And this one would be some antiviral, so some viral thing. Okay, now let's see if there is anything like really thing that could be really dangerous. Let's first of all figure out which one is which, okay? Lots of things can go wrong actually with this one. Let's do a physical and a temperature first, okay? Physical, temperature, even a chest, because these are all very quick. Let's do that first. Hopefully that actually gives us the correct one. So, okay, now when I do okay, did these people, this is still waiting for me. Why? Okay, I have to go here. Oh, because he's just walking around. So why is he still waiting for the paper? I don't know. Examined. Going to chair. But Jordan is still waiting for me for whatever reason. Okay, I'm gonna keep an eye on that. Okay, venomous spider bite, we already know that. You don't have any urgent issues. Let's do a physical so we can actually see if you have any issues. I think we did that actually last time. I apologize for that. So yeah, let's just do that and let's see this guy. Okay, let's go back again. Jordan Harris is still waiting for player. This is the guy, right? I already told you, go to an echo. What are you waiting for? Go and echo. Yeah, don't wait for me. All right, let's see what he does. Hopefully he does go and gets an echo. Okay, Lisa Taylor. He's still just being observed. And he's gonna get actually some treatments first. That's the idea. And also some exams. So let's go here. What do you have? For now, I don't care about Jordan Harris. We will check him out later. Okay. I hope he is going to get his echo because that's the whole idea, right? So let's see. You have either need antibiotics. Actually, you only need antibiotics for sure. However, let's do a differential. Can you do a differential? Yeah, you're good. And I think I did that last time. So as I said, I'm kind of replaying a little part of what I did before. Nancy Jones, okay, you are covering up my patient. So that's not good. Hold on. Gonna put it here. I wanna keep an eye on her, and that was another bloody mosquito. Look at that. I'm getting good at it. Okay, so you have chest pain. All right, and it's 2 o'clock. You might be my next person I will have to put in the hospital. However, if I want to put her in the hospital, I have to send her over to ER. So let's do some. Oh, hold on. We already did a lot of things. Physical, chest, thorax, blood, temperature. Okay, let's do CRP. Okay, to see if something is it inflammation or this or that. I'm not sure if we need to do a speech chest pain. I want to do something that is actually useful. How did I do it last time? Because I'm pretty sure I did something last time. We can actually do a speech listening. That's quick and neurological testing. And let's see if you have patients, you have oxygen saturation is good. Okay, right now this is a bit guessing, so let's just do that. And then let's go here. In the meantime, I'm just keep checking. She's still just chilling there. Because last time, actually, again, I didn't save, which is really bad. She was already suddenly being treated, and I didn't see that, so I don't want to miss that. Coeliac, whatever, disease. So we already did all kind of things. We figured out what's wrong with you. CT or serological. CT would tell you if you need bone strengthening. Now you are 28 years old. I don't think so. Forget about it. And serologic testing would just tell you that you have this disease. So I think we're just gonna treat you. No, we're not go to, we're just opening it. Okay, you have tenderness and fever, and you are actually still doing the microbial cultivation, I believe. Which, oh, last was the microbial sampling. So we did that already. No, microbial sampling, and now they are doing the cultivation. So we really don't have anything else to do. We just wait for you right now. I think. Okay, because we did the microbial sampling, we collected these, and now we have to wait in the lab. So I believe I think we're just gonna wait, or should we do something else while he's waiting? Um, I mean, we can, but maybe totally useless. Should we do... Where is he right now? Okay, I'm again doing this. Is he still in the doctor's office? Yeah, he is still in the doctor's office, so we could still do something if we really wanted to. Where is Kate? Lisa Taylor? Lisa? No. Okay, so now he says hospitalized, feeling free time. That's weird. Just now he said that he was waiting for this and that, so I don't know. Sorry guys, I'm trying to pay attention to this one, but okay. Should we do something else while we are doing it? We already did some ECG. I mean, we already did a plethora of things. We did all kind of things. I mean, we did pretty much everything that is simple. What would a PCR sampling tell us? Infectious disease would actually ELISA and all kind of PCR, whatever, show us that he has some, that's for the infectious diseases. Microbial, we already do that. We already do blood tests, so there's nothing we can do. I mean, we could send him for a CT just for fun. But I'm actually just on the side of why don't we just... What is this fast? Can we do a fast? No, we cannot. That would be... Has to be a trauma center or ICU. Is he... Let me see. If he one of the people who possibly dying, like not dying, but like close to collapsing. No, there is Margaret Young. That's the only one who is supposedly like that. Although I have no idea. I mean, this part I haven't really figured out yet because it's here and there, So angiography would find out a couple of things. Maybe do a urine test, or we already did that. We already did that. So, you know what? I'm just gonna wait until he gets his results, okay? That's all. And Lisa Taylor is still just being observed. All right, what do you have? Venomous bite. Okay, we did the physical. We're not gonna do anything else with you. We're just gonna treat you. There you go. How about you? We already know what your problem is. Nothing else we can do, and it's orthopedia, so we're gonna just treat you. Good. And urinary tract infection. Okay, let's see. So the differential diagnosis works. We know what your problem is. Now, we don't need anything else. Would it give you anything else if I did a urinary? It would give you rehydration, but it's all very unimportant things, and you already get antibiotics for that. So, you know what? Let's just treat you. Again, if somebody's watching maybe 2 episodes back to back, you might feel a little bit annoyed because I'm kind of repeating something. I apologize for that, but okay. Okay, that's a difference. Rattlesnake bite or migraine. You know how I would figure it out? I don't know, I'm just saying. I would ask this poor guy, did you get bit by a rattlesnake? No. Sorry, man, you have migraine. Get the hell out of here. That's it. Like, why do you... You know what I mean? Like, how hard it is to figure it out. Really. So, okay, he has the chance to go to observation or hospitalization, whatever, but he doesn't really need to at this moment. I'm just going to give him a physical chest. Let's give him some chest oscillation. And no need for visual test because both would be blurred. We know that. And he's going to get some eye drops. So, you know what? Let's do that anyway because he will have to get some eye drops probably, regardless of which sickness he has. And I think we're good. Okay. Okay. In the meantime, still nobody's showing up to her. Just to make sure. Hospitalized, waiting for a free examination room. Okay, every time I check on her, it's a different thing what they say about her, so that's kind of interesting. Okay, you have headache. Sorry about that. Hold on. This guy is... Okay, she is dangerous, but never mind. So what do you have? Headache. Go back to Lisa Taylor. We want to see you in the bed. We're obsessed with you. Thank you. So what do you have? Headache. Again, a ton of things. So let's just do a physical. Oh, we already did a physical. Let's do actually maybe an eye test. No, let's do a neurological. Let's do some CRP and blood pressure. Okay, and do an ear exam because that actually can cause headache as well. So you have a lot of things we're gonna check on you. That's fine. Don't go anywhere. At least we know this guy, what he has. Encephalitis is an inflammation of the brain most commonly caused by an autoimmune reaction or viruses. Doesn't sound too good. But then again, at least we figured it out. Now, what else do you need? Temperature management. We already know that you have no fever. We did the infraview. Speech listening, we haven't. Oh, we cannot do it. He might have some hallucinations. That's scary. Okay, again, speech listening, we cannot do that. Chest. We already did that. We did go, we haven't done an ECG, that can be dangerous too, and CSF. So look at that. This one again, I don't know, like this is possibly very dangerous. CSF sampling, can we do it at sampling neurology department? So it has to be here if I want to do that, the CSF. ECG, I can send it from wherever I want to. EEG, I can send him to do an EEG from here. Okay, so let's send him for a let's do a CSF. It is a medium discomfort, sorry about that. So let's do a CSF, an ECG. I'm not sure if we need, let's do an EEG as well, because that can be medium strong. And once we're done, you know what, this one, confusion, is not a big deal. It could be a very low level, so I think we can do it here, but we need to do all these to make sure that he is not having some life-threatening problems. Okay, diabetes, we did an echo, and look at that. He does need ACE inhibitors. Gotcha, and means that it's actually possibly dangerous, that it's gonna collapse, right? So again, let's take a look. Interview, physical, blood test, nothing. So basically what we're gonna do is just treat him with diabetes. Okay, let the doctors decide, but I'm gonna make sure that I give him some ACE inhibitors. Okay, the rest, let the doctors decide. I don't care. Now, how about you, darling? Are you still okay? Yeah. Oh, he's already doing... Apparently, they're gonna take him to an ECG. Okay, so let's watch her. This guy, chef fracture of clavis or simple fracture of clavis? Okay. I believe it's going to be the simple, simply because we cannot do any a surgery. But anyway, I don't know if physical and differential is going to be enough for that. Let's try. Okay, let's try physical and differential. Let's see if it's enough. Now, in the meantime, let's watch this woman because she is supposedly... Oh, sorry, not Nancy Jones. Lisa Taylor. She's supposedly doing an ECG, but I can see her physically still being in the room, so I'm not sure. I feel like a little kid who is like, you know, getting a new toy, but I'm just still waiting for it. Okay, so he has blisters and dark skin. Okay, we're definitely gonna do a physical. It looks like it's probably some kind of burn or something, so a physical would be very good. Okay, we don't have... He probably doesn't have fever, so I'm not gonna do that. Let's see. Okay. Dizziness, headache. Okay, again, not much. We can do a physical, we can do a temperature, we can do a speech listening, and I would do an ear exam with dizziness, blood pressure measure. Blood pressure is actually more likely. Okay, let's do it. Okay, so nothing turned out. So that means that he doesn't have photophobia, I believe. So it could be either of them. Let's do a skin allergy test, actually. That should show it very quickly. And that's very quick. That's the whole idea. And a physical. Oh, I didn't do a physical? Come on. Okay, that's my fault. All right. So we know this person from the get-go that she has bacterial conjunctivitis bacterial. However, now let's take a look here again. In our this department, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Still 13. Nobody's being treated, so it's still 13. But neurology, now we have like 6 people. Okay? So unless I need something very special for it, I think I'm gonna keep him here. Let's see if he needs anything that is really important. Tonometry, he would give eye drops. We already get the eye drops. Analgesics, yeah, let's do a physical. Physical. I don't need that because I already get the antibiotic ointment right here. So let's just go. Oh, here you go. Hold on. We're gonna actually slow down to normal speed because I want to watch. Look at that. Finally, we can actually see her being taken. Now this person has chest pain. And we already did, again, a ton of different things. And it's already 2:44, so I have a feeling she's gonna be the other one. Gonna join here. But before we do that, we should still try to do some things that we can do directly. Should we just go in for an X-ray for the chest? Maybe we should do that. Like, it could probably give us something very quickly, right? Because we already did, like, did we do ECG and stuff? Yeah, we already did blood pressure. We haven't done ECG. Okay, let's do an ECG here. Maybe also an echo. Heart and lungs veins. Yeah, that could be one. Let's do an ECG. And urine analysis doesn't show up in a lot of places, but it could still kind of, we still have like 50 different possibilities. I don't think that urine analysis would be my first idea. We could do a chest X-ray, but I try to avoid that. Angiography makes more sense. Microbial serological, no, not now. No. Yeah, let's do an ECG and let's take it from there. No, let's do a ECG and because it's already in the CAG room. No, it's in the cardiography unit, so it's a different place. But then she has to come back and wait for us. So why don't we just send her quickly also for an angiography? Okay, both of them are very, doesn't hurt her. Okay, now in the meantime, where are you? What happened to my favorite? Hold on, where did they take her? Hold on. I'm looking for... And by the way, I should have followed her because my concern that maybe these people actually took her, the direction they took her was like here. Did they take her like outside here and took her there? If that's the case, I would be seriously disappointed by these people. Where is my CAG unit? No, my cardiography unit. Somewhere here. I don't remember which one is which. I kind of forgot where I put my different... I think these two were. One of the cardiography and one is the... Where is she? Hold on. Let's look for our person. Hey, Rob Drum, how you doing? Hey, Abraxas. Okay, I didn't know that you have a... Oh, you are on... You have a different name on YouTube. That makes sense. Sorry about that. Yeah. How is everything going, my friend? Nurse's station is critical. Okay, it's all... You have only one patient. Why do you have a critical? That's crazy. Like... Doesn't make any sense, right? Lisa Taylor is the one, right? Yeah, where are you? I just want to find you. Thank you. How have you been, my friend? So where are you? Oh, she's taken... Oh, she's just... she just went all the way here. I couldn't see her because I was looking everywhere. Oh man, I absolutely love this game. I'm playing it very slowly and probably a little bit different from other people. But man, who cares? I'm not trying to please anybody. I'm trying to play my own game, and it's actually 3 games in one. One is a building game, one is a management game, and one is actually playing a doctor and trying to figure out what's going on. And I think many people that I've seen concentrate on only one aspect of it. Like somebody, like I saw one which is actually fantastic. Okay, there is one woman. What was her name? Something Swan. Just look for Project Hospital and Swan. I don't remember the full name. She's building up like gorgeous, gorgeous full hospital. Like it looks absolutely fantastic, but he doesn't do anything about actually the rest of it. Okay, some people build, just build something and they make it beautiful. Some people uh like working on more about like who is the management stuff, but I haven't actually seen anybody trying to do what I'm doing, which is like actually you know fixing people. So I think it's absolutely fantastic. Now this guy is in some oh, he has necrosis, that's why. So he needs debridement. When you have necrosis, basically you have some dead tissue. Rob drum, it becomes more of a builder. Yes, some people play it 100% as a builder game. They never ever try, because the way the game used to be before some updates, you couldn't even control everything. You could only like, I think you could go be like up to 10 people or maybe 12, and the rest was always controlled by the computer. But by now, you can control every single one of them, you know? Yeah, exactly. It's not just, I mean, caring about the people, it's a bit too quick for that. But still, yeah, I mean, you are like trying to figure things out, and actually, you feel that you are doing it. And sometimes a game day time takes me 3 or 4 sessions to actually finish. And for some people, that's crazy boring. For me, it's not. I like it. So if some people don't like it, I'm sorry. Uh, they can still probably watch my videos and just skip through, skip through, skip through. Let's see what's going on. Or they just find the actual parts when I'm building something. Like you see, now I'm already built up some money. I'm going to do some building very soon. But for now, I just opened hospitalization today. So I'm actually excited to see how that all works out. All right, so what we're gonna do here, we're gonna actually just simply treat him. I gotta let her treat him, but let me just make sure. Yes, he is getting the debridement. Okay, that's the most important thing. All right, and she is being pushed out. Okay, I just want to make sure that they don't push him out here and go that way. So that's my main concern when I'm watching this. So let's see where he goes. In the meantime, what do you have? Okay, at least you don't have a lot of possibilities that would cover. Yeah, thanks, my friend. I mean, that's just my personality. That's how I like to do it. If I do something, I'm trying to do it in detail and fully, and sometimes actually screws me up because there are games when you really try to do everything, you end up like not being able to go anywhere. Some of the big games. But that's just how I play. So if somebody likes that, then they're gonna enjoy my channel. They're gonna enjoy my videos. If they don't, then some people complained about Ostrich that, oh, I played 1 full hour and I only built 9 houses and a forestry and this and like 3 more things. I don't remember what he listed out. And it's been already 1 hour. And I'm like, dude, I played about 4 or 5 hours before I got to the nine houses. So. So anyway, you already pretty much treated. The only thing, tonometry will give you eye drops, but you already get it. So let's just treat you. Now, it should be neurology, but since we can give you everything here, I'm just going to treat you here because neurology is a little bit overwhelmed at the moment. And let's see. Now, I'm actually normal speed because I want to see where she's going. I don't want to just disappear in the air. So I'm keeping an eye on this woman here in the back just to see what's going on. Simple fracture of pelvis. Look at that. So the differential diagnosis and physical did the trick. Perfect. Now, there is nothing else we can do, so let's just treat it. Again, it should be orthopedia. Let's see, how many people in orthopedia? 0. You know what? I'm sorry, my friend, because you have to kind of fix it and it needs time. You go to orthopedia and you get yourself fixed. Thank you. Bye. And then this person here. Rattlesnake bite. Okay, so we are sure about that now. A visual test and a physical goes a long way. So let's just see that. Chest oscillation, we already did. Physical, okay, so there is nothing else we can do. However, you definitely have to go to, again, we're delegating people away, which is good. You have to go to traumatology and they're gonna fix you up because only in traumatology you can have antivenom. You cannot have antivenom in the ER department. So like I already know a lot of things. Like I see a symptom or I see something, I already know what's wrong with him. I already know what is the, for example, if this is the case, like if you have an asthma, for example, you have to have an echo because there is a possibility that you need ACE inhibitors. Otherwise, you can die and stuff like that. I'm literally learning things about medicine, although, of course, I'm not going to become a doctor just by playing this game. I admit that. Okay, so now we are in normal speed, which could be painful to watch for some people, but at least we see that he's going the right direction. As you can see here, I actually did a little trick here, which is this area and this area, I made it blue. So supposedly nobody would come from here. Okay? But if I made this area blue, then nobody would dare, nobody would dare to come in. That's one thing. But basically, it would show that this whole area is not, how can I cannot reach this area. It's not accessible. So I don't know exactly how that works, but so far it seems that my color management actually worked. Okay, so that one is taken care of. Let's go to this guy. Okay, again, good. We know what your problem is. Do we need even some physical? You already get antihistamines and NSAIDs. What else do you need? Oh, you might need some steroids. Okay. In this case, which is actually funny because I thought that you would get them for this. No. So we're gonna definitely have a physical. And if they find some rashes and whatever, you're gonna get some steroid creams. Okay. I'm always amazed by the routing of these people. Sometimes it's kind of funny. Oh, okay. You have some high fever. Critical stage, there is at least one symptom leading to collapse. Okay, so before you do anything, let's give him some antireplics. Okay. The rest is kind of fine. We already know what his problem is. That's a good part. So let's see, after that, we can do some oral cavity. Oh, we cannot. No need, that's okay, because he already has he would get some pain medicine, and he already gets it here, so no need. Swollen lymph nodes would give him NSAIDs. Oh, we haven't got NSAIDs yet. Okay, let's do the neck palpation then. Let's see if he needs some NSAIDs. Physical would just give him some rest, which we already give him. Eye drops, we already give him. Eye drops. PCR testing with just eye drops, and PCF is only eye drops. So basically, we don't even need to do a physical. Although technically, I always like to give a physical at all time. But let's just go. Okay, and look at that. She is no longer in danger because her big high fever is suppressed. Perfect. Let's see this pirate lady. Oh shit, she has a possibility of like 14 or 15 different sickness. Red eye. Okay. We already did. Hold on. He is still doing. He just did a blood test. Nothing came out, but he still does serological and microbial cultivation. So I'm just gonna let her keep getting those. Let's see Patricia here. Okay, this thing is too big, but that's okay. Headache. Oh, and you already have, again, like so many different things. Again, this could be one of our next person going into observation because we have so many things and it's already almost 3 o'clock. So our observation room might be filling up very quickly. And if that happens, here's the trick. If that happens, we already planned out 1, 2, 3 more observation room with some doctor's offices and everything. By the way, they said, hold on, let's just do one thing here. Nurse's station is critical. I don't know why, to be honest. Oh, well, our overall prestige is 99%, but people are not really happy. Prestige is high, but the staff and the patients are not really happy because we have patients are bored, mean staff, and long wait. Annoyed, couldn't dry hair. Okay, we have some issues here, but I think we're fine. The nurse's station is critical, so you know what? Let's actually get one more nurse here. Technically, we need one, and that's enough, okay? But let's just get one more because for whatever reason, this nurse's station and no assigned janitors too. Oh yeah, night and day. Okay, fine. Okay, so I'm gonna get one more nurse here. We have a ton of money, so we can do that. Patients care only 7%. That's not good. And she's a pig. Now, the good thing is they don't have any hidden things, so we can just look. This one is a night owl. That could be good for the nighttime. Although she sucks. Better than this. Patients care 7. That's not really good, I would say. But she can be part of a surgery team, and that could be maybe useful later. We can shuffle things around if I need to. So why don't I get her? Just for now. So that we have 2 nurses here. So one nurse is staying here, although right now nobody's here. So not a big deal. But why do I do that? Because I'm thinking about putting her into the hospital, in here as well. By the way, we are still pushing that poor woman here. Let's not forget. Where are you? Here. We are still pushing her. So if I put Patricia, but she just have a headache. I mean, but so many things could be wrong and we still don't know. So the question is, should I also put her in observation or maybe do that a little bit later? I think I'm going to do a little bit later. For headache, we already did these. What else can we do with a headache that could make sense without anything like serious? Let's do a pulse oximetry. Let's do an ophthalmoscopy because that could be, if you have some eye problem, that could have headache. Basic visual test, blurred vision could be in some places. Neck palpation, nasal, thorax, oral, audiometry, I don't know. The rest, to be honest, doesn't really strikes me as helpful. Let's take a look here. If it's cardiology, we already checked his temperature, right? I'm pretty sure we did. Ophthalmoscopy, we haven't. CRP, we did that, right? Yeah, we did. We haven't done an angiography. Angiography, I don't think we can right now. Can we do an angiography? Yeah, we could if we really wanted. You know what? Let's do like a urine testing because some of the things, not many, but some of them could be. Okay. I think ECG. Okay, you know what? Let's actually do something more. EEG. Let's do an ECG because that's like something that could avoid some really serious problems. And I think if we haven't done a blood test, did we have a blood test here? Blood draw. Let's just do a blood draw, okay? Should we do like a full CBC or just a blood draw right now? Let's do a blood draw and... Yep, on your way. Okay, let's get rid of this because it... Oh, okay. I thought that he's gonna go through the wall, but it was just an optical thing. Okay, what do you have? Oh, perfect. So we don't even need to know because you have all the... We already found all your symptoms and you are in the right place, so... Brilliant. We have another person actually fully treated. Now, this is going to be the first time that when the day is over, the day is not over because we already have 24/7. Okay? We already open 24/7, which means that people who are needing some exams, I believe they can actually do that. They just cannot go back to the doctor. They have to go back to the doctor like the next day, for which I apologize sincerely. Okay, so we did find it out that he has atopic dermatitis and he has all the symptoms. So, Paul Martin, please do me a favor and treat this person. Frank Wilson. Okay, again, we know what's your problem. However, this time we have to open this and let's see what we can do. Chest pain, swelling. I would definitely do a physical. I would probably do a, yeah, chest escalation, exactly. Thorax, I would do a thorax. This one? No, actually it doesn't recommend me to do a thorax. Now, what would USG do? Just give me this, which I already have. And geography would again find the same thing. So, no need. Although this can be a very serious issue. So we already know that that's what you have. Okay, so we just do a physical, just to see. Wait a minute. What do you get from there? I think I'm not even going to do a physical actually. Okay, maybe it's going to give you some anti-inflammatory cream if necessary, okay? But chest osculation is important because then we can give him bronchodilators, okay? So let's just do that. And this poor person is still being pushed. Now I'm in the slow mode, so this is like the normal mode, which I stopped doing because in this case you have some gap between patients, and the way normally I do it, jumping from one to another, there is nothing really too much I can see anyway, so I normally just jump to the next one automatically. But since I'm trying to follow this woman around, this time I'm going to do it slowly so I can actually see what she is doing or what she's going through basically. Low voltage burn, okay, now that's going to be a traumatology, that's for sure, because we need burn management. Although, let me see, just we already know that that's the problem. Burn management, yeah, you have to go to traumatology. Sorry, my friend. So how many people are in traumatology? We have here 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Only 12 people here. Nobody's still being treated. That's kind of, it's stagnant, you know? We have one person in hospital, and the rest is still like not really good. Only one person we know the results, and we only have 3 more hours, so that's kind of crazy. We have 3 people in traumatology. One we already know the problem. He's just waiting. No, two we already know 2 of them we know the problem, and one is being treated. So, yeah, you just go to the traumatology anyway. There is no choice. I was just thinking, should I send him first and then do, for example, a chest escalation, or, and that's what I'm gonna do. So I'm gonna send him over and ask them to do a chest escalation. Blood draw, we don't need that. Okay, so you're gonna do it at the other department, not here. Oh, okay. I thought that she went inside here, but then she didn't. Alright, so the stretcher they take out. No, actually, let's go back here for a second. Do we have our second nurse? Where is it? Where's the nurse? Where is the second nurse? I already hired a second nurse. Where are you? Hold on. Let's actually check this thing out. Where is the nurse? Register nurse. Yeah. Actually, I don't even know which one is that. We have... Wow, we actually have 3 nurses. One is assigned for... Oh, that's weird. Where are those people? Brooke Thomas, patients care. Trauma patients transfer, okay. Lisa Johnson, same. Oh yeah, one of them is 9 times. Sorry, this one is 9 times. So Jane Jones is the one. Feeling free time? What kind of free time are you talking about? It's work day. It's 3 o'clock. What do you mean free time? Of course, technically speaking, we don't have another patient here in the hospital. So could be, Lisa Taylor, you are being examined. Okay. And let's get rid of this here. Okay, so you waiting for a player. You already suppressed your fever, and we did a neck palpation, didn't come up with anything. Oral cavity we don't need because it would be just analgesics. So actually we don't need it. NSAIDs, we don't need that because you don't show up. Oh, that's good for you, man. I wish I could do that. Okay, can I ask you something, my friend? Did you check out some of my other videos from this series? Because mysteriously yesterday there was somebody apparently watched from the beginning till the end 4 of my videos. Well, ER hospitalization is like this, okay? So you have basically some trauma centers, 2 trauma centers where you can actually, if you have, for example, an ambulance bring in somebody, if there is an ambulance comes in, then throws it here, okay? Not directly to the clinics. And if somebody's collapsing or something is very serious, they can come here and they gonna keep him here and check him everything out until find out what's wrong with him because he's in very, very serious condition. They have an observation place, which is just basically like a normal hospital bed. When, for example, this particular person, the one that I'm following around, Lisa Taylor, we already did, we actually found out quite a bit of things already about her, but uh, she has a few different things that can be dangerous. So it's better if she's in a bed until we know what's exactly going on with her, and then she can be released. So if you take a look at here, she is actually in this bed, okay? And she's a medium risk of having some collapse or anything, but so far so good. So that's the ER hospitalization is basically just that, and you always have a doctor station. What is that? Oh, that's a doctor, yeah. You always have a doctor station and you always have a nurse station with that. So nurse station, doctor station, and observation and trauma center. That's basically the ER hospitalization. Okay? It's actually, okay, and I think it's wasting a little bit of time. Okay, so I'm not gonna fill up these places that quickly. Anyway, let's see what this person needs. So I don't think that she needs pretty much anything. She would have eye drops. Yeah, so let's just treat this one. And once she's treated, she can go home. They are doing the ECG on her. Tell her to take off her clothes. Put back her clothes. That's pretty quick. Okay, what do you have? You have weakness. That's pretty vague. That's pretty vague if you ask me. Let's just do physical. A speech listening, because let's see if he's confused or anything. She is weak. Yeah, he is weak, sorry. It's a man. Let's do a chest oscillation. And I always check a temperature. I think for now that's enough. Could do a blood pressure next time, but for now I think that's enough. Okay, let's get rid of it because I want to see what's going on. I'm gonna go back to her for a second. ECG found out. Did anything? Nothing came out of ECG then. They are still doing it anyway. So she's got red eye and she already looked at that. She has 3 pages of testing. Schedule have finished. Microbiome sampling was finished. Okay, I'm gonna go for her. So she just sampled, but she hasn't done a microbiome cultivation and serologic testing. So she needs to be tested for, she needs to wait until it's done. So let's just okay it. I just have to watch out because if it takes too long, I have to send her to a hospital early enough if she needs to wait. Okay? Let's go back, actually, Lisa Taylor. Watching and come back here. Okay, what do you need? I think we have everything that we wanted. We don't need thorax, USG, angiography. We don't need any. Oh, wait. No, we don't need any of them because that's all this problem. So let's just treat it as it is. Okay. Now, let's see. He has a breathing problem. So I don't like that they don't give him the bronchiolitis. Pain, chest pain, swelling, redness. Okay, so swelling, no need for the ICEP. I can deal with that. Just one last thing here. Hypothyroidism, okay. That is actually a general surgery issue. Let's see again. General surgery we have, because as you see, we still have a ton of people here. We want to send them away because it's already over 3 o'clock. In general surgery, we have 1 person, and I think we have like at least 2, maybe 3 doctors. So you know what? We know that it's a general surgery issue. I think we have to fire our receptionist because she's not sending the people to the right place. Or maybe at least we have to train her. So you go there, and then you do, let's say, let's just start with the physical. and maybe a speech listening, okay? Because you have depression, okay? And that's it. We don't waste your time. Anyway, oh, okay. And Lisa Taylor, look at that. She actually, we realize that she has an irregular heartbeat, which will need beta blockers for sure. Okay, so that one is already done. Now, I don't know if I have to give it to her or I'm just gonna give her the beta blockers. Like, I'm gonna actually order to get the beta blockers. Beta blockers. Anyway, guys, I need to go. I have to go to work and it's time. So I really enjoyed so far. I I think it's over 3 o'clock. From now on, if I really have to send people away to do some long, some tests that take a long time, I think I'm gonna start putting them into the observation room soon. The only thing is that if I do it more than with 3 other people, I really will have to open up this place here. I really have to open some of it up, which means the negative side of it is that we're gonna have to have more doctors and nurses, um, ready for it. So let's that's gonna be next episode. All right. So thank you guys. Thank you so much, Rob, to coming for coming. I hope that I see you again very soon. And also, if anybody likes what you saw, please hit the like button, hit the follow in Twitch, hit subscription, and I hope that we're gonna see you soon. Thank you, and bye, everybody.